Hello everyone, my name is Courtney Havner. Today I am doing a presentation and discussing key issues within preventative mental health care delivery. There's a YouTube link available. Obviously you've clicked on it for audio and video, but follow along in the slideshow and to receive more information about this topic. So according to the World Health Organization in 2022, recent data shows that there's approximately 1 billion people suffering from mental disorders, whether they have family or they're personally diagnosed. There are effective preventive and treatment strategies that do exist, but most people don't have access to effective care. There are socioeconomic inequalities within a lot of communities that contribute to the problem with accessing preventative mental health care delivery, such as inequality of education, employment. Those social inequalities combined with social stigmas surrounding mental illness make it very difficult to provide preventative care for children and adults around the country. According to American Journal of Preventative Medicine, psychiatric nurse practitioners can address gaps in accessing healthcare, especially in rural communities where there's, a lack of transportation or providers in the areas. This is likely going to benefit the mental health care community, and they'll be able to focus on preventing and decreasing adverse mental health effects from lifestyles. So to analyze this topic, we really need to define prevention in order to fully understand delivering preventative care. So public health framework from the Institute of Medicine classifies mental health prevention as the reduction of new diagnoses and disabilities, reducing the duration of cases, and minimizing the prevalence rates of mental disorders in the communities. There's lots of techniques for early diagnosis. One technique is preventative early screening to kind of help decide if you need to intervene with early diagnosis and treatment. Challenges in the preventative mental health care delivery. Basically, the key issue that I have researched is preventative mental health care delivery is very hard to access. That's the biggest challenge. There's many factors that contribute to this issue within accessing mental health care. Predominantly socioeconomic factors such as the inequality of incomes, social inequalities, poor education, and their employment status. A lot of people are unfortunately without a job, which means without insurances, so that can cause a huge barrier to access. Other challenges that surround preventative mental health care is the stigma and discrimination that surrounds mental health disorders, and this can make it very difficult to obtain treatment when suffering from mental illness because you're very scared to reach out and try to find treatment. Ethical considerations that need to be discussed in this presentation. There's obvious inequalities that create barriers to accessing mental health care issues. I think it's really important for psychiatric nurse practitioners and other healthcare providers to be ethically considering the injustice that is represented in communities, knowing that there's certain groups of people that are adversely affected by their social disadvantages and that contributing to mental health disorders. That's something that we need to ethically address as providers. In order to address these prevention strategies, government officials will, hopefully help along with tackling the inequalities that are present in communities in order to address, future generations' mental health, improving social determinants of health, education, employment, social care, housing, criminal justice, poverty, social security, welfare benefits, developing communities. Those are all things that we need to contribute to and focus on. In Michigan, there is a lot of barriers within accessing preventative mental health care. There's certain socioeconomic inequalities that can contribute to the delay of preventative measures in rural Michigan. Specifically geographical inconsistencies, very large areas without any providers. As stated on the slide, there is a shortage of mental health care providers in rural Michigan, and that can cause limited access and higher ratios for patients and providers. According to the Michigan Health Endowment Fund, there are 25 counties in Michigan that doesn't even have a provider or a psychiatrist in their county. This is a huge problem, obviously, in accessing mental health care. So how can we change this? Planning for resolution. Number one, reducing the barriers to accessing care. So as I previously stated, addressing those social determinants of health is a big one. There's always going to be a need for increasing funding on the state and federal levels for mental health care services, and it's important, for us to hopefully expand our services such as telehealth services. That'll be a huge step forward in delivering preventative health care to a lot of different communities, urban and rural. There's a lot of different areas that lack transportation and providers, not just rural areas. Number two, reducing stigma. So focusing on mental health care and the widespread awareness of that in communities is super important. Educating the public to directly attempt to reduce stigma and increase the willingness to seek treatment is a huge step in resolving these delivery issues in preventative care. Number three, increasing public awareness. So as previously stated, we want to increase the willingness to participate for many people in the communities. Increasing public resources will be huge for people to be able to seek treatment, as well as increasing knowledge. I think it's super important to have communities have multiple resources for their individuals who are suffering with mental disorders, that makes it easier to access preventative care. Providing educational campaigns to communities and schools is super important, I think, for the younger generations especially. Lastly, collaborative support. I think that addressing these key issues within preventative mental health care delivers a collaborative approach between large societal entities and healthcare professionals, so it's super important to do so. I leave you with some questions for discussion. Is it possible to one day combine mental health care and physical health care into one entity physically? And if so, why? If not, why not? And next, what innovative strategies can be implemented in urban cities with prevalent poverty rates to help encourage the community to seek treatment? Thank you so much for this. I appreciate your attention. And if we could all work towards the goal of providing preventative healthcare to communities, I think that'll be a huge thing for our healthcare. Thank you.